to follow up on the WHO resolution.
Stephanie, it wasn't very easy to hear your question. It was quite garbled. I think you were asking about the G7 discussions that were around WHO, and you were asking how important that is to WHO. Was that the essence of your question?
Yes, can you hear me?
No, better.
Better now.
Yeah, okay. Reuters reported last Friday that Germany and France have quit the talks, the G7 talks, as the US is trying to lead these talks, despite having said they are quitting the organization. So my question is, how important is it to WHO that the major powers sort of speak with one voice and follow up, the WHO resolution aimed at learning lessons and reforming WHO? Thanks.
Yes, well, I'll pick up on the last point, Stephanie, there. I mean, the resolution that was agreed, the resolution 73.1 of the last World Health Assembly, contains a large number of actions to be taken by WHO and the member states, including the comprehensive evaluation of the response thus far, but many others around the ACT accelerator and vaccines, around surveillance, around so many other things that the world needs to get on and do together, both now and into the future. We know the G20 have also been discussing this issue of global preparedness now and into the future. We know the European Union have been doing that, and many different regional and global bodies have been really sitting up and taking notice of the fact that this pandemic has come. This pandemic has taken people by surprise, and we need to do better in future in order to stop pandemics like this and invest in the long-term solutions. So we're always pleased when bodies like the G7, the G20, the European Union, ASEAN and so many others get together and really take these issues seriously. And obviously the G7 have been some of the richest and most powerful nations in the world, and organisations that quite frankly have invested a tremendous amount technically, operationally and financially in the World Health Organization. It's always a good thing when they're talking about global health, when they're talking about the threat of pandemics and how we work our way out of this one. So we welcome those engagements. We are not part of those discussions or negotiations, and we would leave it to the participants in that discussion to clarify what their positions are in that discussion. We trust that such powerful and capable nations have consensus around how they wish to approach the global health security. We all occupy one planet. We are all vulnerable to the risks anywhere on this planet, and we need to find global solutions, both in terms of preparedness and response. And we trust that the G7 will play a major part in that in the months and years to come.
Thank you very much, Dr. Ryan.
In symptoms, infection rates, even among particular population groups. I know it's not yet clear, but I'd love to know where you think the evidence lies on that at the moment. Thank you.
So thanks for this question. It's a very good one. You did answer your question and say that it isn't quite clear yet, but having said that, this is an area of active discussion amongst our groups, amongst our international networks. And what you're referring to are the common cold coronaviruses that circulate globally. There are 4 of them. And what that means for somebody who has been infected with one of those coronaviruses, does it mean that they have some level of protection for the COVID-19, the SARS-CoV-2 virus? We don't have an answer to that yet. What we're discussing with our laboratory networks, and particularly labs that have experience with doing T-cell response or a cellular response, is trying to understand if somebody has a T-cell response for SARS-CoV-2, what does that mean? Does it mean that they've been exposed to the SARS-CoV-2 virus and have antibody or have the T-cell response to that? Or did they have an exposure to another human coronavirus? We don't have a complete answer yet. So this is called cross-reactivity. And we're trying to understand what this means in terms of potential protection, if any, to this new virus that emerged at the beginning of this year, and what that means going forward. So what we're trying to do is design some basic studies that need to be done in the laboratory to look at what T-cell response is and look at cross-reactivity. These studies can only be done in a handful of labs globally, so we're partnering with those labs to better understand. In addition to that, we're looking at adding a T-cell response to some of the seroepidemiology studies that we are supporting globally. So we can look at both an antibody response and a T-cell response to see what it actually means in individuals and look at that over time. But we don't have a complete answer to that yet. But I can assure you that we have incredible scientists that are working directly with us on this and with all of you to help us better disentangle what this means.
Thank you very much, Dr. Van Kerkhove. We now have a question from India, from Avijit from AM News TV, India. Avijit, please unmute yourself and go ahead.
Yeah, thank you very much for taking my question. Can you hear me now?
Very well. Please go ahead.
So, Dr. Van Kerkhove just mentioned that WHO is still learning about the virus. Vaccines are a far cry, and the economy is absolutely shattered all over. So now my question is, the virus emanated from China, Wuhan province. So where does the investigation stand, and what are the actions being taken so that in future such things do not happen, and this virus, and what is the status of this virus worldwide?
Yes, I'll just clarify your question. So you're asking about the investigation into the origins of the virus, and you're asking about the setting up of the mission to investigate. Is that correct?
Yes, absolutely.
So I could start at the public health importance of looking at the source, the zoonotic source of the virus. So normally what happens is wherever the first cases emerged, and in this case, the first cases were identified in Wuhan, China, that's where the studies begin. You start there and you look at what were the exposures of these individuals, you look back in time, you look forward in time to really determine what are the types of activities that those individuals did in terms of travel, in terms of exposure occupationally, in terms of everything that they did in their daily life before they developed symptoms. And then you move from there and you follow the science, is what we say. We've done something similar for the first SARS virus in 2003. We did the same thing for the MERS coronavirus in 2012, 2013, where we needed to do these studies at the animal-human interface, we call it. And we basically look at what are the types of exposures that people had to determine where the animal origin came from. So those are where the studies will begin, and that's what will happen with the SARS-CoV-2 virus.
Yes, and it's important as well, I think in general, just to reflect on what we've learned about the virus in terms of the ease of spread, the multiple modes of transmission, the existence of asymptomatic and pre-symptomatic transmission. This virus is proving exceptionally difficult to stop. It's difficult to recognize, it's difficult to distinguish between it and other syndromes unless you have adequate and immediate testing. You're seeing that now in countries with influenza and with COVID at the same time. So this is not an easy virus, and not an easy virus either to detect. It's not an easy virus to stop. And obviously the first clusters of cases were certainly picked up in Wuhan, and that's where an epidemiologic investigation would always start. But that does not, and we've done this, and I've done this for over a quarter of a century now, case zero is not